So I'll come to my first question to Dr. Sanjeev, because Sanjeev is practicing in UP from a single clinic, and most of the pediatricians there would have a hospital and would be working from their clinic too. The general feeling that a family gets is that the pediatrician ends up treating the child and then his child, and the child stays a child and keeps coming back to the clinic. So you have these families who get their child and say, Doctor Saab, isko internet wala bimari ho gaya. Dr. Sanjeev, do you firstly get such kind of people, and what do you say to them about
Yeah,
this?
definitely. These type of children, they go into the closeting. They are more involved in internets. This is a common thing with these children. So we have to affirm what he wants. This is the most important thing for us pediatricians, that we should affirm to what he says, and we should educate the parents that they should affirm to. Otherwise, he will go in hiding. He will hide the things. He will not reveal the things. This is the most important thing. So we have to tell them that the child is not sick. He's not bimar. He's not bimar. He's hiding the things because you have not affirmed this. So this is a normal variant. We have to tell them this is a normal variant. जैसा आपका वेदों में पुराणों में होता था, there are many characters which were variant, normal variants, and they were still worshipped like anything. So they are not looked down upon. So we have to tell them this is a normal variant and educate the parent on gender. We have to educate the parents on gender. We have to tell them about the resources, and we have to tell them that these children have got good opportunities in life. They have a better, good future, and there is nothing sudden. This is a gradual things which is progressing. So we have to tell them that this is progressing. We have to build the trust of the parents with the child, and we have to tell them that you should tell the child we will go together with you. So that's what we have to affirm, so that the child doesn't go into the closet and he reveals the things. This is the thing.
Thank you so much, Dr. Sanjeev. Dr. Kochhar, I had a question for you. Most of the practice that happens in India is, like you rightly pointed out, there is government doctors and then there are private doctors. And the general feeling is that maybe some doctors know more, and the ones who know more are sitting in the private, since the government doctors are so busy with simple infections, they probably don't have time for issues like gender. Is it possible and feasible that a thing like hormone therapy or puberty blockers, can this thing be taught to the primary caregiver? Because that family has the trust with the primary caregiver. Your comments on that, sir? You need to unmute yourself, sir.
Sorry. Okay. So that's a good question. So the thing is that, as I was mentioning, that there are a lot of, actually the use of GnRH analog, the puberty blockers, is more in the private, because people are not that they're more educated than the government doctor, but because the most of the parents who are educated and who have money also, and so they come more into private practice as compared to going to the government hospital. Even today, I give a good example. Most of the the netas or national who got COVID, they all went to private hospitals. No, I'm just giving you an example. They went to private hospital treatment. Even after granting in government, the next day they were shifted to private hospitals. They never stayed in there. You must have read all in the newspaper. So there is something in the public that if I get sick, if I go to this hospital, it'll be better. They have more facilities. It may not actually be true, but this is shown by the leaders also, the same thing. The same scenario is shown by the leaders also. So even they didn't go to AIMS, the best institution they say in India, but they went to the other hospitals to get treatment. So that is there. So as far as teaching the physicians in the government hospital, it can be there. But as I told you before, this creating a concept of people knowing about transgender first is more important Then the primary physician should have an idea. You teach them, give them talks, make more CMEs on this and make people aware of it. They can give it. It's very easy to give a GNL. Once they consult me, I said, yes, go ahead. It's fine. They can continue with it. You can continue. I'm doing that with my patients who are pubertal, who are going to early puberty, have precaution puberty. These patients, I'm letting the GPs now give the injection. First 2 injections I give, and I say, okay, now you continue. Because patient coming from Aligarh, coming from so many places to Delhi, it's not possible sometimes. Now in this COVID time, 5 months, there was complete, nobody used to come. So I had teach all the general pediatricians in their places, start using it. All the pediatricians were giving it, not general, but general pediatricians were giving it. So it can be taught. It's not difficult. But as I told you, the public always, even after they show in a government hospital, they come to a private hospital and take an opinion before going ahead for the therapy. So I think we just need to create more awareness, and maybe your team can help in that by fixing up more, CME, more events with, general physicians and making them aware of this, because it's not difficult giving a puberty blocker. And it's very easy. Like, in UK, you follow up with a 3-month or 4-month with your endocrinologist. They can do the same thing. Send back to the endocrinologist after 3-4 months. Everything is fine. All going on well. Yes, everything is fine. Going on well. Send back to the general physician or the general pediatrician. So it's not difficult. It can be done. But as I told you, the trust and this among the general, most of the people is they go to the private, get it confirmed, start the treatment, then only they might go back to the doctor. And sometimes I've seen, it's not that, patients from many parts of the country, are coming to me, and most of them are sent by, even Sanjeev has sent to me, so basically what I'm trying to say is that, the trust is more with the people initially with the private hospital. Maybe they think that, they're doing better or they have more setup, and government doctors do not have time for this transgender. I'm so busy with URIs, upper respiratory tract infection, lower respiratory infection, and skin problems. I say, oh, छोड़ो, इसको छोड़ो यार. Transgender, I will see it later on. इसको किसी के पास भेज देते हैं. उसके पास भेज दो, उसको मैडम के पास भेज दो. So this is a tendency in government hospital. Push it off. Give it to the other fellow. The other fellow push it off to the other fellow. So it's like that. So unless they are aware of it, about this, what is transgender, what has to be done, then only they'll start using it. They will not use it even if I teach them, because they don't know what to do, what is transgender stuff. So that's why I think that has to be done. So maybe the ATHI team can take up this and make people aware about it. Because putting up in the net, there are two, like you mentioned, there you have to you have sessions, or you have to some talks or something, I don't know, about this transgender, and people get certified. No doctor will come forward with it. Very few doctors will come because they're not interested. So you have to make them interested in the sense that you have to teach them, go to that level of teaching them. Like if you have different IAPs there, get into the IAP, make people in IAP bodies get involved in that, let them there is this IMA, and get into those bodies involved. So once you will get into those bodies, it will go down tech down. Otherwise, I talking to them and just only telling them, they will not use it. Government hospitals is very, very different. You also know, Sanjay, how the situation is in government hospitals. Very, very difficult, So therefore, in the private sector is different, because, in the private sector, we have, most of our referred patients, which come to us, and we know that, okay, this is this, let's do like this. So I send it back to the physician. Many times, कौन इसकी सरदर्दी लेगा, छोड़ो, वापस भेज दो डॉक्टर को. This is a common scenario. So I think what we need to is make it more awareness, more talk, more the understanding of what is transgender. Then only we tell them to give pivotal blockers. Because if I don't know the basics, how will I do this?
So one important thing is that the telling them the difference between the gender and sex. It's a general idea that is gender and sex are the same things. So this is to be inculcated. Pediatricians को भी ये थोड़ा सा पता चल जाना चाहिए, थोड़ा करके. The sex is different. The gender may not be same as the sex. So this is.
So I think when they know the definition that gender incongruence means that your gender identity is different from the sex assignment. Uska definition yahi hai na. So I think once they know the definition, they will understand this thing.
This is to be taught. thoroughly, then only they will take interest. Otherwise, यही होगा, डॉक्टर कोचल के पास चले जाओ यार.
Once again, I have succeeded in my mission of stimulating the pediatricians to think and for the participants. Look at what such a senior pediatrician has said. It is not the drugs, it is the education. And who is to be educated? The parents, the primary caregivers. Because the drug is no rocket science. It is so simple to do. But what is most important is the teamwork. And that takes me to you, Nandita. You have talked about a flow chart and you have shown that. And you yourself, after having spent more than a decade as an endocrinologist, did say that your experience is not too much in this field. That gives me an indication that even in the West, the opinion is that if you have a child who is in the minority and who people don't understand much about, then don't allow people who don't understand to handle this child. Your comments on this?
Absolutely. So it's very clear the system, it's very different in the UK. Everyone has a general practitioner, which we have which is, NHS is care for all based on, not based on ability to pay, but on the need. And we all have an NHS number and get free treatment. So it's very well known that if there's a question of gender identity issues, gender incongruence, the general physician, the GP, will refer to they have pathways, right? This issue, this is where you refer. And there'll be support groups. They'll be aware of support groups. There's a waiting list for 3 or 4 years at present. So in the interim, they may contact us and say, we would like this started, and we'll say, no, we need this in CAM's input. So there have been very few which we've got involved in, but this is from advice from the Tavistock Center, from the CAM's team, and from the family, just because of the long waiting list. But absolutely, this is so specialized that everyone, you need to be a real expert. You can't get it wrong. So no one will refer me a patient.
Thank you so much for...
Unless it comes indirectly from the specialist team. You're absolutely right. Yeah.
Thank you so much for highlighting that issue. And there's another very important thing that Nandita has brought out, and that is why we set out to write the Indian standards of care. Because our systems are very different from systems in the West. So if we want to give care, then we need to do it in our system. And I would like to inform all the participants that we are now talking about the public health approach. We are talking about, educating the society, looking at the social issues and saying that the social issues are probably not more important than the medical issues, because transition is but a small part of a being's life. The society in which this being is going to evolve is a lifelong event, and we require all experts to provide what is there in science to this being. If we have invented the wheel, then we have made travel possible. If we have developed the wings, we have given flight. And this is all the miracle of science. It has enabled the human being. So when we are looking at an issue which the majority don't understand, then actually the incongruence is not with the minority who are right. The incongruence is with the majority who don't know. And once we start looking at it like this, that is the time when we will have a systemic view of the issue, and we will start telling the majority that please learn, please open your minds. And this learning is only possible when we speak or we teach at the level that a person is ready to learn. And that is the effort that ATHI is doing. Quickly, I have just, I'm creeping into the next session. And that's another very important session. So I'll quickly take one take-home message from each of you. So Dr. Sanjeev, what is the one take-home message that you would like to give the participants? One only.
I have enumerated so many. I'll just go through the messages. There are many messages for the pediatricians actually.
So give one. We will take one.
Yeah. You can pick up one from that. So the most important thing is the early recognition, then individualized care, and we should use respectful, affirmative language. This is the one most important thing that you are asking. Use respectful, affirmative language, and we have to make them learn also. Make the parents learn also, and make the pediatricians learn also. And we should avoid causing harm. There should be assessment of comorbidities also. And we should have a support group, psychological support, gender affirming participative approach, and supportive and safe home environment should be there. And then we should have education, proper education of in the curriculum should be added in the curriculum, and the proper education of the parents also. Advocacy on behalf of the child and family. This is the job of the pediatrician. We have to own that case. So we should consider socio-cultural and legal factors also, and facilitate the social transition as early as possible, and proper and timely referral for hormone therapy and onsite. For us pediatricians, these are the take-home messages, as I think so.
Thank you,
Dr. Nandita, if you want to add something.
Yeah, thank you so much.
Coacher sir, you also.
Dr. Nandita.
Oh, so it's my turn. Okay. So I'll just summarize what Sanjeev has said using an acronym. Learn, we have to really listen, and listen is just not here, but listen and feel for when a child comes to us as pediatricians. E is for educate. Educate, of course, the child, the family, the school, but educate ourselves. Gosh, I've learned so much, Dr. Sanjay, just being involved with ATHI over the last few weeks. And educate ourselves, it's so important, you know. It's easy to say, yes, we know what it is, but we have to really feel it in our mind. We need to be an advocate for the child. As pediatricians, we are a child's advocate. Encourage the parents to be advocates. And we are the resource as pediatricians. If it's a child we are talking about, we are their resource. And we are the professional resource. And of course, N is just to complete we have to be non-judgmental. Absolutely. We have to almost feel as if we are the child, and how we would feel if how someone would, you know, put ourselves in their place, and then see how that, and speak accordingly. It's tough. It's really tough. But yes, I think it's a whole process we have to go through. I'm sure Dr. Kochhar, Sanjeev have already gone through. We all have, you know, as things have evolved with gender incongruence. Yeah.
So we have saved the best for the last. And the reason is that sir's got such vast experience, both national and international. So sir, your one message for the participants who are here, sir.
Yeah, so awareness, education. And ATHI should make it a point to spread more awareness and education, so that people, you know, like me, when we talked today, Sanjeev talked and Nandita talked, we are trying to create, and we learned also many things, you know. So I think we have to make people learn, and ATHI should play a big role in carrying on these messages which we are creating today. And, you know, and like I told you, make it into go to the government level, to the public level, and people will definitely follow. And please, please try to get a gender clinic, try the clinic made anywhere in India, so that people know. They're on the website open, transgender, yes, there's a clinic in India. People know about it now. So I think that is the, very important message we must take, because I can read all this in internet, that this is there, this is there, this is there. But what we need to do is what we have to, and ATHI should take a, foot ahead, a roll ahead, pull the ball forward, that we have to get a clinic in India where people know, because if I open net, I might say, no, the child opened net, oh, in the clinic, I have a place to go and talk to someone there. So he will do it. So there, if just playing on the internet will not help, like the question you asked, Sanjeev. So I think if we have, things where we can ask people to go and get it, and because one clinic, it goes second clinic, go to third clinic. That's how it goes out anywhere in the world, evolution. So you will see this now in 2019, we made this legal. You can have a, once you have a sex surgery, and then you can have a gender legal third gender. There's something big achieved, thing happening in our country, which we never thought could happen at all, So I think ATHI has to make it a point. Awareness, education. That's it,
Thank you so much. Thank you so much. And that validates what we have been saying at ATHI, that we require a public health approach. We require a center of excellence, a place where it is taught as a subject, skill development, training, short courses, long courses, not only medical sciences, social sciences, gender clinics, hospitals. We need departments, interdepartment understanding, so that the individual does not run from pillar to post. We understand that we are there to give care. Thank you for the lovely and vibrant session. I am sure that we as pediatricians, made it a very interesting, almost like a playground kind of feel that we wanted to push our voices through. And I'm sure, I am certain that we'll, be heard. Thank you so much, sir.
Thank you, Sanjay. Thank you, everyone.
I'm going to close the session, and I'm going to invite the student volunteer for the next session to please take on. Thank you so much, sir.
Thank you, Sanjay.
Thank you.
Nandita.
It was
Thank you,
lovely
Nandita.
to
Bye.
take part. I've learned so much from this whole process.
Yeah, sure.
Thank you, everyone, for joining.
Bye.